Good morning, OR team. Ready to sign in. Our patient is Miss Effie Jimenez, 19 years old from San Fernando, La Union. She will undergo an emergency appendectomy due to acute appendicitis with suspected perforation. Consent for the procedure and anesthesia induction has been secured and signed. She is hooked to a cardiac monitor with initial vital signs of BP 110/70, PR 88 beats per minute, RR 18 beats per minute, O2 SAT 98%. No known allergies. Excuse me, Dr. Fontanilla. Is there any difficulty with airway management or risk of aspiration?
No anticipated airway difficulty. The patient has been fasting for more than 8 hours, reducing the risk of aspiration.
Thank you, Doc. Excuse me, Dr. Marzo. Is there any risk of blood loss exceeding 500 ml?
There is minimal risk of major blood loss, but we have 2 units of packed RBCs on standby if needed.
Thank you, OR team. I am Nurse Eliza, circulating nurse signing in. Good morning, OR team. Ready for timeout. Please introduce yourselves by name and rule.
Dr. Marzo, surgeon.
Dr. Fontanilla, anesthesiologist.
Nurse Myra, scrub nurse.
Nurse Eliza, circulating nurse. Excuse me, Dr. Marzo. What are the critical or unexpected steps, operative duration, and anticipated blood loss?
The appendix may be perforated, requiring careful peritoneal irrigation, and operative time is estimated to be 30 to 45 minutes, and blood loss should be less than 100 ml.
Thank you, Doc. Excuse me, Dr. Fontanilla. Are there any patient-specific concerns?
No major concerns, the patient is stable, and anesthesia is well tolerated.
Excuse me, Nurse Myra. Has sterility been confirmed? Are there any equipment issues or concerns?
Yes, sterility is confirmed. No equipment issues detected.
Cefazolin 1 gram IV was administered within the last 60 minutes as prophylaxis. Thank you, OR team. I am Nurse Eliza, circulating nurse timing out. Excuse me, Dr. Marzo. I would like to inform you that the needle, sponge, and instrument counts are correct and complete. May I confirm the operation performed and how the specimen is to be labeled, if any?
The operation performed is emergency appendectomy, and specimen is appendix for histopathology.
Thank you, Doc. Excuse me, OR team. Ready for sign out. Our patient is Miss Effie Jimenez, 19 years old from San Fernando, La Union, who was undergo an emergency appendectomy. Excuse me, Nurse Myra. Are there any equipment problems to be addressed?
No equipment issues reported.
Excuse me, Dr. Marzo. Are there any key concerns for recovery and patient management?
We should monitor for post-op infections, continue IV antibiotics, and assess for pain management.
Excuse me, Dr. Fontanilla. Are there any key concerns for recovery and patient management?
Pain management is in place. The patient will be closely monitored in the recovery room.
Thank you, Doc. Thank you, OR team. This is Nurse Eliza, circulating nurse signing out.